Mr. Speaker, I rise today to support getting Americans the help that they need. More than 1 in 5 911 calls involve mental health or substance use crises. That amounts to millions of calls per year. To keep these Americans safe, we need to connect them to health care. It is wasteful, hurtful, and a travesty of justice to criminalize people in mental health crises rather than deliver care. 1 in 4 fatal law enforcement encounters ends the life of someone with mental illness. We cannot improve public safety without giving our communities a better response system for mental health crises. My bill, the Mental Health Justice Act, funds local communities to create specialized mental health response units. Made up of trained health professionals, these units can be dispatched to respond to emergency calls for mental health. That way, people in crisis can get the care they need. Police officers can focus on crime, including stopping violent crime and other core law enforcement duties. And our communities get another tool to address our mental health crisis. The Mental Health Justice Act has widespread support from advocacy organizations fighting for mental health and civil rights because this approach works. In cities that already have these programs across the country, we see incredible positive results and support from local law enforcement. In Orange County, our law enforcement officials support this bill because their job is already difficult enough. They know their sworn duty is to prevent and solve crime and hold criminals accountable. Sending police to mental health situations diverts their attention from crime fighting. I've heard firsthand from officers who want specialized mental health response units. This bill empowers police to stay where they are needed, fighting crime. At the same time, entangling people in mental health crisis in the criminal justice system or holding them in jail wastes taxpayer dollars and doesn't deliver on public safety. When we send police to people in crisis, we fail to get those people desperately needed health care, and we take law enforcement away from tackling the violent crime that they are trained to take on. This hurts everyone in our community. The Mental Health Justice Act is supported by a broad bipartisan coalition, co-led by my colleague from Orange County, Republican Michelle Steele, and my colleagues Ayanna Pressley, Tony Cardenas, Mary Gay Scanlon. Keeping Americans safe and healthy is not a partisan issue. I am proud to champion the Mental Health Justice Act, a tested, effective solution to promote public safety and well-being for every American.